Hi, I'm Ethan Lewin, and I will be presenting on cystic fibrosis. Cystic fibrosis, or CF, is an inherited genetic disease that mainly affects the lungs and digestive system, often leading to a shortened and difficult life. Throughout the presentation, I will inform you about the causes, symptoms, diagnosis, prevalence, and treatments of cystic fibrosis. Children who inherit one CF gene from each parent will be diagnosed with CF. The origin of cystic fibrosis comes from a mutation in the CFTR gene, which makes a channel for chloride ions to go in and out of cells. Chloride helps to ensure the movement of water in tissues, which is crucial for the creation of slippery, thin mucus. Mutations in the CFTR gene wreak havoc in the chloride channels, which impede the flow of chloride ions and water across cell membranes. This causes cells that line the lungs, pancreas, and other various organs to secrete thick mucus instead of thin, loose mucus. The thick mucus often blocks the airways, causing the characteristics of CF. Each person who suffers from cystic fibrosis experiences different types and severities of symptoms. Over the course of one's life, symptoms may increase or decrease depending on the circumstances. In the US, CF can be diagnosed directly after birth before symptoms arise because of newborn screening. Since the technology is so new, people born before newborn screening may not be diagnosed until later on in life when symptoms and signs of CF appear. Adults diagnosed later in life tend to have a less severe version of the disease and often experience recurrent pneumonia and an inflamed pancreas and suffer from infertility. It's known that parents who kiss their kids to bed will taste very salty tasting skin. This is because people with CF have a higher salt concentration in their sweat. The rest of the symptoms affect the respiratory and digestive system. These include persistent coughing, frequent lung infections that result in pneumonia and bronchitis, shortness of breath, difficulty with bowel movements, poor weight gain and growth, and intestinal blockage. CF can be diagnosed in multiple ways. The two most common methods of diagnosis are a sweat test and newborn screening, like I mentioned earlier. Other methods include getting a genetic test or carrier test, a blood test, chest x-rays, a pulmonary function test, and stool evaluations. CF is common in the US. According to Stanford's Children's Health, CF depends on your ethnic background. Cystic fibrosis affects 1 in every 3,000 white newborns, which is the most common. Cystic fibrosis also affects about 1 in 17,000 African Americans and 1 in every 31,000 Asian Americans. The average life expectancy of CF patients is only 44. As of now, there is no cure for CF. However, there are treatment options and ways to manage the disease. These include airway clearance training techniques, medications, clinical trials, pulmonary rehabilitation, and surgeries that include lung transplants. Patients who undergo a lung transplant surgery may improve and extend their quality of life, but they have to live a cautious lifestyle to keep the new lung healthy. Cystic fibrosis is a non-curable disease that affects people with a mutation in the CFTR gene. The mutation disrupts the flow of chloride ions in cells, which results in buildup of thick mucus. The thick mucus results in airways, ducts, and passages to be clogged up. This leads to signs and symptoms of CF. Cystic fibrosis mainly affects white newborns in the US and is much less frequent in other ethnicities. Despite the disease not being curable, there are treatment plans that can ease symptoms to lead to a more peaceful life. And these are my references. Thank you for listening. I hope you learned something new.